Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Gastric ulcers and its types. So we are going to look at the classification based on the Harrison's 20th edition in the Principles of Internal Medicine. So the type 1 is situated in the gastric body. So it is associated with the gastric body. And where is the acid production? The acid production level is low. So what is the surgical management? It is going to include the distal gastrectomy Billroth type 1. So it is a distal gastrectomy, and this is going to involve the Billroth type 1. Next, what we are going to see is the type 2 of ulcer. So here it is associated with the A, that is antrum. So here the acid production, it is about low or it is normal. So it is low or normal. And what is the surgical management? Surgical management here is the distal. So here it is nothing but distal gastrectomy. So the distal gastrectomy as well as the vagotomy. Vagotomy or the involvement of the PPI. Next we move on to the type 3. So in terms of type 3, it is within 3 centimeters of the pylorus. So it is within 3 centimeters of the pylorus, and it is accompanied by the duodenal ulcers. So there's presence of the duodenal ulcers. So what is the acid production? So the acid production here is it can be normal or it is higher. So type 3 is higher, whereas in type 2 it was low or normal. So it is getting higher only in type 3, which is situated with 3 cm to the pylorus, accompanied by the duodenal ulcers. So here the surgical management is by the distal gastrectomy. So there is the distal gastrectomy and also the vagotomy and the PPI. Vagotomy and the PPI. Lastly, we move on to the type 4. So this is type 4 as per the classification by Harrison 20th edition. So in class 4 it is associated with the cardia. Okay, the location is nothing but the cardia, and the acid production is considered low. The surgical management will include the pouchet. The surgical management is nothing but pouchet. It is the Senday's procedure, pouchet as well as the Senday's procedure. So this was about the Harrison's 20th edition. Next we move on to the modified Johnson classification as well. So what happens in the modified Johnson classification? So in this type of classification, first one is it is present in the lesser curve. So first one, it is in the lesser curve. So to put it in the diagram, say this is the stomach. The first one is going to be here. That is in the lesser curve or the insula. So here there is normal acid secretion. Second one is the body of the stomach, insula, and the duodenal ulcer. So it will be in the body of the stomach. Next is the insula, as well as the duodenal ulcer, So this is it is active or healed. It is active or healed, and this results in the increased acid secretion. Next, what we have is the pre-pyloric. There is pre-pyloric. So this pre-pyloric, it stands for the third class. So in pre-pyloric, it is this is in pre-pyloric. So if you look at the diagram, this is where it will be. That is, this is pre-pyloric region. So pre-pyloric, there is an increase in the acid production, increase in acid secretion. So one we saw was lesser curve and insula that has normal acid secretion. The second one was the body of the stomach, the insula and the duodenal ulcer. Third one is the pre-pyloric. As you saw, it has an increase in the acid secretion. Now looking at the fourth one, there it is higher on lesser curve. It is higher on the lesser curve. So higher on the lesser curve, this will be here. So it is nothing but high on lesser curve. So here there is a normal acid secretion. There is a normal acid secretion which is seen. Lastly, we move on to the fifth variety. So fifth means it is completely medically induced. So this is going to be medication induced. So by medication induced, we mean that the presence of NSAID, NSAIDs. Next is the presence of the acetyl salicylic acid. Acetyl salicylic acid. So it can be present anywhere in the stomach. So till now we saw it can be present in specific locations. Here it is anywhere in the stomach. To learn and grow daily like this, please do subscribe.